everybody, Dr. D here talking today about the importance of estrogen. And if you're scared to use estrogen and don't know what type to use and don't know how to get started, this video is for you. So one of the things I like people to know is that there are estrogen receptors all around the body. We have about 300 different estrogen receptors, which means cells all over your body use estrogen. Your brain is one of the top places that uses estrogen. So when it comes to menopause, when it comes to perimenopause, when it comes to hormonal imbalances throughout life as a woman, estrogen is super important to monitor because it is about our long-term brain health and cognition and more. Another thing that's important to understand is that we do have 3 different types of estrogen in our body, and we also have a way that our body detoxes estrogen. So part of how estrogen can impact us and impact us in the right amount, not too much, is also based upon the ability of our body to appropriately get rid of estrogen. We break down estrogen in our gut and in our liver. And when we break down estrogen, we essentially get rid of the recycled components and get rid of them. If we don't do this correctly, estrogen could stay in our system longer than is typical normal and then have an impact that is higher from a standpoint of what the normal response to estrogen would be. So you want the right amount. You absolutely want estrogen, and you want to know how your body is actually breaking it down, how your liver and your gut are doing to break it down and detox it correctly. Now, there are situations where we can have infections in our gastrointestinal tract or overgrowth in our gastrointestinal tract. Situations such as small intestinal bacteria overgrowth, known as SIBO or SIBO, can also lead to situations where estrogen is not metabolized, it's not broken down correctly, and could impact us in higher ways, meaning less estrogen goes farther. So you want to make sure that when you're thinking about estrogen and you're thinking about estrogen replacement therapy, that you're really working with somebody who's going to test and knows how to test. Depending upon when you take your estrogen and what form you're using, if you're doing HRT, will depend upon if you want, say, a urine test or a serum test. If you're doing things like pellets, for example, you oftentimes want to test those about the middle of the pellet cycle. If you're doing patches, usually it's a couple weeks, 1 or 2 weeks after you get the patch on. So depending upon what form you're using is actually going to depend upon what test is needed and when the test is done in order to monitor your levels appropriately. So there's so much value from cognition, from brain health, heart health, bone health, on and on and on with the use of estrogen. But you do want to work with somebody who's testing and retesting and knows how to test at the appropriate times as that replacement therapy to make sure you are on the appropriate dose, as well as making sure that you are detoxing and eradicating it properly. So that's all for today. Please do subscribe to my channel. Please do take my libido quiz. The libido quiz can be found in the show notes. Libido quiz is a great way of looking at, beyond hormones, what could actually be leading to low sex drive. I'll see you soon.